The following program is made possible through an unrestricted educational grant from Glaxo Wellcome and is produced in cooperation with the Central Florida Reception Center of the Florida State Department of Corrections. The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views and opinions of Glaxo Wellcome, World Health Communications, or the Florida Department of Corrections. Before using any medication mentioned in this program, please consult your healthcare provider for more information.
Hello and welcome to Get Tested, Get Treated, and Get Smart about HIV and AIDS. I'm Dr. Diana Williamson, and I'm here from Harlem United AIDS Community Center in New York City and St. Clair's Hospital. I'm here with my fellow panelists, Charles Colley on the far left and Laura Cirillo from the Altamont AIDS Education Program out of New York State. We're here today at the Central Florida Correctional Reception Center near Orlando with a live audience. Today we're really here to talk about HIV and AIDS, and the reasons for it is that as time goes on, there's more and more treatments and medications that are available for HIV and AIDS. And so it's more important to know your status, to know whether you're HIV negative or whether you're HIV positive. Knowing this gives you the opportunity to know more. You get a chance to get tested, you get an option to the treatments that are available today, and also by getting the knowledge, you are getting smart about HIV and AIDS. Some of the other reasons that we wanted to talk about HIV and AIDS today is that there's a lot of myths and a lot of misconceptions that go around what is HIV, which is the virus that causes AIDS. And so we really wanted the opportunity to be able to talk about it, to maybe get rid of some myths that are out there and reinforce some information and some positive information that you may already know. So with that, I'd like to turn the program over now to Colley, who's going to be our first presenter today.
Hi, everybody. All right. I'm going to try to engage you here for a minute, okay? Let's get past the bullshit and let's get busy, all right? I've been here, done this. I'm not impressed. I spent 17 years of my life locked up. There ain't nothing you can tell me about the penitentiary. Nothing. I know the shit you do up in here, and I know how most of you living. So what I want you to do is I want you to think for a second. What you doing with this time? How valuable is this time to you? Or do you want to continue doing the same dumb shit every day for the rest of your life till your number play? That's what I did. Came to jail, got caught up in the bullshit, and forgot why I was here. Lost focus, spent years doing nothing. Left at the age of 40 with a 7th grade reading level. Not marketable, had no skills. The only thing I could do was what you trained me to do, and that was to come back to jail. Because that's all that goes on in here, is bullshit on how to come back. What I'm going to do today is I'm going to try to help you dispense with the bullshit, okay? It's about what you can do to save your ass once you get out of here. We're talking about AIDS. I lost 4 family members to the virus. I lost a brother and 3 sisters. I come from a long line of drug users. See, I did what I wanted to do when I felt like doing it. How many of you can I do that? Now, if everything that y'all talk about in the yard and out the cells is real, then everybody up in here needs to get tested, because if I'm not mistaken, most of you are talking about the boots that you knocked, the loot that you was handling, the keys that you was moving, the pistols that you was carrying. But more so than anything, it's the activities that you was engaging in. Unless most of you, like me, was good liars, okay? Because if I don't know nothing else, I know this. Some of you wasn't doing jack in New York, Florida. Nothing. You know it, I know it. In the way. Have nothing to show for you being out there. Got arrested or rescued in the penitentiary. Some of you know there's nothing waiting for you when you get to the street. I suggest strongly that while you're here, take advantage of what's being offered. Now here's a clear-cut example of what I'm talking about. We're talking about bringing you some information about AIDS, HIV. We're going to check you on your behaviors, the things that you claim you was doing in the mix. Okay? Now I know everybody wasn't knocking that many boots, getting that much money. I know this because, like I said, I lived a lie for years. Coming here, perpetrating, fronting, lying about my activities in the street, getting busted for bullshit and claiming I was about something, wasting valuable time. Check it. You know exactly what happened when you was in the mix. And if there's nothing else I don't know, they can tell you. These are my peers. They've been educated. They do the same identical thing I do. Now, I've been in the street 8.5 years from my last bit. You know what I do on a continuum? I educate inmates about this virus. I've been carrying this virus 10 years. 10 years. It's not easy having this because it's a constant reminder. Blew it. I blew it, man. I wasted a life fronting, and now things is right up close on me. You know what it is to know that your number's about to play? I know that if I resort back to the way I used to live, I won't be here long. There's nothing that comes with being in these penitentiaries, beating each other down, hitting each other in the head, living the foul life, because that's how I was living, foul. I did Mama Duke when I was out there. How many of you ever taken anything from your mother? Or everybody in here was getting theirs from the street? See, that's what I'm talking about, the lie. See, some of you can't even be honest straight up in here. Some of us know that when we was in the street, we was setting it off on moms, taking things from people, doing what we wanted to do. Now, I'm going to tell you about this getting tested piece, because I got tested in the penitentiary. I found out I was HIV positive on my 4th bid. I was turning 40. 40. I had never done nothing. I'm 40 years old and I didn't know how to drive. I had never been on a bike. I had no marketable skills, man. All I ever done was allow myself to be locked down. I wasn't a productive member at nothing. I wasted life. I learned how to drive at the age of 43. 43 years old, man. I still can't swim. Do you know what that means? That means that I haven't done much. People bungee jump, scuba dive. Collie ain't did jack. And I'm 50 now. I don't know if that hits home for anybody. I know what it is to work in a mess hall, floors. I know what it is, man, not to have jack. This is real, man. Today, real people do real things. I don't fake it this no more. Life's too short. If you came up in this piece and you think this is a game, maybe you need to listen carefully to what we got to say. Because you don't have to get this. You get this as a result of you going out and asking for it by the things that you do, what you engage yourself in. I want you to take a real good look at me. I got a life today. And I got a life as a result of being educated. I got smart. I stopped listening to the bullshit in the yard, listening to dudes kicking the Willy Bobo, talking that fly, want to be $100,000, and was about 2 cents in New York, in Florida. I know about that. I got smart. I started educating myself about this. I started educating my friends, my family members that were still alive, my nieces and nephews. I stand for this. I don't go around doing things that put other people at risk. I check myself. I check me today. That's important. That's the reason why I'm here. I don't know none of you. You probably never see me again. But we all come from the same cloth. We was all about the same. And if you was true to this game, like you claim you was, check your track record. Check it. Or, like I said, some of you know you're perpetrating that being a real criminal, being really down. Because being really down is doing any and everything to get yours. And if that's how you was living, step up the game. I don't know if you've been tested or thought about getting tested, but maybe after this program, if there's any method or means, I suggest you follow up on it. In closing, I want to ask one question. I want you to think for a second. How many of you, since you've been locked up, given a telephone number or an address to somebody that you met in the penitentiary? Exchange numbers in this joint? You don't rub shoulders with dudes and like their style, the way they move, how they get paid? Huh? Well, I've done that. And I sent people to my mother's house that I didn't even know. I didn't know their medical status. I didn't know nothing about it. I sent them around my kids, my loved ones. And I'm quite sure that some of you done developed some camaraderie. My man, when I see you in New York or I see you in Florida, we're gonna get busy. But do you really know the person that you claim to be your man? You know him well enough to ask him his medical status? Or do you do the same thing that I've done? I wanna know how much time you got. What you in it for? As opposed to asking you the appropriate questions to really get to know you. It's all about fronting, perpetrating, lying. That's all I ever done. The end results, HIV and AIDS, man, for a true player. And now I'm going out, and I'm hoping that I make a difference. And with that, I'm gonna turn this over to somebody that's gonna give you a rundown. That's going to give you all the information that you need to protect yourself when you get up out of here. Then we're going to turn it over to the doctor, and the doctor's going to educate you about the materials and the medications that's out there. And after that, it's on you. It'll be in your ballpark. Laura?
Hi, my name is Laura. How's everybody doing today?
All right.
Real quick, before I do the AIDS 101, I just want us all to be on the same page so you know a little something about me, you know who I am and what I'm about. So I'm just going to tell you, I work in Albany, New York, that would be, and I do AIDS education in the prison system up there. Just so you understand, my title with the Altamont program is a peer educator. Does everybody understand what that means? Somebody tell those of them that don't know what that means. What does that mean? What does the word peer educator mean? All of you that said yes, this would be the time when you should say something.
Educate the people that you live around and the people that you work around.
Exactly. Educating a population that I can identify with and that can identify with me. A little bit about me. I'm 29 years old. I'm a recovering addict. I've spent the better part of my life in active addiction and in and out of facilities similar to this one. As a result of me doing what I wanted to do when I wanted to do it for most of my life, I am also HIV positive. I've been in the street nearly 4 years. I'll be coming up on 4 years in a couple of months in the street, and they haven't arrested me since. That's a good thing. The whole message, just so you understand, we're going to go over basic education. How many of you have had HIV and AIDS education just by a show of hands at any point in time in your life? Most of us are on the same page. The information is real basic stuff. It's stuff you're going to know as I'm saying it. But the message, the thing that you need to get if you don't have it, is that we live. People need to know that because there's a lot of misconceptions about what happens to people when they're HIV positive. We live. That's the message. Get tested, get treated, get smart. Self-explanatory statements, gentlemen, self-explanatory. You get tested, you want to know whether or not you're negative or positive. Overcome the fear, because then you can get treated. You can go see a doctor, and you can find out what's best for you for whatever point you're at with this. That is obviously the smart thing for you to be doing. How many of you have been tested? I'm not going to ask for a result. I just want to know how many people have actually gone and taken the HIV test. Do you all remember that? What is it, like a 2-week wait? Do you remember that? How'd you feel? Just tell me. Just scream out. How'd you feel during that 2 weeks or whatever amount of time it took for you to get? Scared, nervous, sweating bullets. For those of you that came up negative, you got lucky. If you didn't do shit, you wouldn't have been scared. And that's the reality of it. You rolled the dice and you beat the odds. I wouldn't ride that horse out into the sunset. The testing procedure is really simple. For those of you that have a fear of testing, you need to know it's not going to kill you. It's not going to hurt you. You can't get the virus from being tested for the virus. The purpose of testing, really simple. You want to find out whether you're negative or positive. What the test shows. The test does not seek out HIV. The test seeks out HIV antibodies, which is what your body produces when you become infected with the virus to fight the virus. What they will do is after they draw your blood, they will send it to a lab. On every sample of blood, they will do the ELISA test twice. The ELISA test seeks out any viral antibodies. If that comes up positive, they will do a confirmation test called the Western blot. The Western blot specifically seeks out the antibody to HIV. If this comes back positive, you're positive. Testing options. Now, I don't know what options you have at this particular facility. I'm sure that somebody in the audience does. I'm sure somebody knows what's available to you here. But generally, your testing options will be to either take an anonymous test or a confidential test. The difference being this. An anonymous test, you are just a number. You go, they give you a number, you get your blood drawn, you come back, you give them a number, they give you your results. A confidential test means you give them your name and you are protected by the confidentiality law of your state, meaning they can't inappropriately disclose your status to other professionals. It's illegal. Does anybody have any questions about any of this? Just so you guys know, at any point in time during this, if you have a question, if you have a comment, just raise your hand and we'll address it immediately. For those of you that don't know, what does HIV stand for?
Human immunodeficiency.
You're close. Human immunodeficiency virus. To break that down, to spell some of the myths we have, human. We are human. We give this to each other. If one more person starts asking me about monkeys and mosquitoes, I don't know what I'll do. Human. We give this to each other. We don't get it from animals. We don't get it from insects, including mosquitoes. What's your immune system? What is your immune system? I know somebody in here knows. It protects you. From what? Fights diseases. Over there, you want to add to it?
It's the bodily function that helps fight off any kind of foreign.
Absolutely. Absolutely. It's your body's defense mechanism. When you have an immunodeficiency, your immune system is being attacked or compromised. Does everybody know what a virus is? Well, that's with HIV, that's definitely what it's doing. But a virus in general, does everybody know what a virus in general is? Since everybody knows, somebody tell me. It's like a microorganism in your body. What's the one thing about a virus that baffles us, that baffles mankind? It can mutate. What else, though?
It's incurable.
It's incurable. We do not know how to eradicate a virus from a body. What does AIDS stand for? What's the definition? Absolutely, thank you. For the purposes of education, what would you say the most important word in that is? Acquired. Why? Because you get it. That's one other thing I'm kind of tired of hearing, is somebody testing positive and saying, oh, so-and-so gave me this. No, that's not how this works. Once you have the information, you go out and you get it. You ask for it and you get it. It works real simply like that. It's not as easy to get as people like to think it is. You have to do certain things in order for this to happen. Let's talk about transmission and prevention. Before we talk about how HIV is spread, I'd like to talk about how it's not spread. Because even though, what year is it, gentlemen? It's 1997, absolutely. And there are still some people out there that do not know how to act. Now, I need to say honestly that I know nothing about Florida correction system, but I know that in New York State, I've heard horror stories about what happens to people that have HIV and AIDS while they're incarcerated. People still get burned out they sell. I don't understand the thought process. I don't understand the ignorance involved in that. That's just for me. I don't know where anybody's from. I don't know how you all were living. I don't know what brought you here, what you were about out there. If you lived any kind of a lifestyle like me, I personally remember seeing people catch the beatings of their life on the strength that they were HIV positive or had AIDS. People were ostracized from their crew. People were getting beat, and nobody was taking their money before they knew they had this. What I need to say is that that's ignorance. There's nothing wrong with healthy fear of the virus, nothing at all. What you need to know is that to get educated and have the information is your responsibility as a man or as a woman. You need to know that to not know the information and have it readily available is ignorant. There's no reason to disrespect somebody because they have a life-threatening illness. I don't get it. So let's go over how it's not spread so we're all on the same page and nobody can say that nobody ever told you what was okay and what wasn't. How is it not spread? Okay, but what I mean, would you shake my hand?
By shaking hands.
Is this safe? Yes. Thank you. What else? Hugging, shaking hands. Using the same toilet. What else? Eating behind each other, the swimming pool. Kissing. What else? Drinking behind each other. The showers are safe. Water fountains are safe. Playing sports. Well, to get into that, if you have open wounds and you can find blood-to-blood contact, no matter if it's sports, fighting, or any other physical activity, blood-to-blood contact is going to be a risk. And everybody needs to be aware of that.
How about sweat?
Absolutely not. Absolutely. Shaving, I mean, if somebody's using the same razor as you, is there a risk? Absolutely. Absolutely.
Question.
Sure.
I'm a plumber by trade.
Good for you.
And, the question I have is, you're talking about how it's not spread, and it was brought up to me the other day, and I've been thinking about it, is I would do a lot of sewer lines being in the prison system, and I'm the East Unit plumber, I just came from the South Unit. Is there a problem with working around feces, urine? I mean, it's raw sewage, we're around that a lot.
I absolutely hear you, and what I'm going to tell you about that is you should have no fear when it comes to feces and urine, unless there's a presence of blood.
Well, see,
That's the piece. And if you can't tell, you want to take what they call universal precautions in your job, which hopefully you do anyway on general principle if you're dealing with raw sewage.
Around here, I mean, to be honest with you.
You don't have like gloves?
Cheap rubber,
Are they latex?
gloves, but
If they're latex, they're a complete barrier. If they are latex, that is your best defense in any way, shape, or form against the virus.
But see, with us, we go into the lift station, and we're shoveling raw sewage 3 times a week. You know, we don't go in with boots. Some of us have sores on our legs from construction sites. And it's just a question, you know, because you get the the crap and all the other fungus on you, and you don't take your clothes, you don't change your clothes, you know, you work all day in it. And it's just a question, you know, is there a possibility from working around the urine and the poop that it's going to get in your system? Is there any way that I'm going to be infected from doing my job?
Diana, do you want to?
I'd like to take a crack at that. To tell you right now, there's a lot of professions in which people, you know, as you said, you're a plumber by trade, so that means a lot of people in the country do plumbing. There's never been a case of HIV that's been documented that's been related to plumbing or contact with feces or urine. The problem when you're doing works like that is the potential of getting bacterial diseases or a skin rash. But HIV virus doesn't stay alive in blood for very long. So you assume that by the time, even if there was some blood in there, you're talking a couple of days before it gets down to you, the virus is not alive in the blood. So you don't have to worry about HIV transmission.
Okay, well, some of the sewer lines that get stopped up, people try to flush sheets, uniforms down, and we're right in there within the same day. I mean, within a couple hours of them
The virus
trying
doesn't
to...
stay long outside in the air for more than a minute or two, so you don't have to worry about that as a major means of transmission. That's not one of the concerns.
All right, thank you very much.
You're welcome.
I'd like to know when the first document outcome of the HIV or the AIDS virus was. It in the 50s or the 80s?
I'm not even sure. Diana might know the answer to that.
The epidemic was first noted in 1981, and now what we know about HIV transmission, it means that people were getting sick at least 5-10 years prior to that. There were some isolated cases in which people had rare diseases that nobody knew what they had, and blood was saved. And one of the earliest documentations that I know of is 1954 in Norwegian, where a family essentially died, and the blood was saved and later was tested when the HIV test came positive and was able to identify that that's what that family had. So there have been isolated cases reported before 1981. But the epidemic proportion, meaning that it's hit the whole country, it hit the whole world, that didn't start until 1981.
I was wondering that if the government knowed of this outbreak, and then the doctors was under some type of restraints not letting the public know at that time that this virus was occurring and just calling it just plain old cancer. And I'm quite sure if I was a doctor in that field of sciences, I would, through the testing, I would know something else was actually going on, and that they gave it a name, which is HIV, but it wasn't exposed to the public until the 80s that they seen the fast spread of the disease. And most likely, I see it's mostly been spread throughout the third world countries, and then most of your third world countries is getting more pressure upon them from the disease as being the actually carriers of the disease, and it's actually poor countries.
Okay, you've actually brought up a lot of things and a lot of questions in one statement. I'm going to try and address them real quick, and then let's see what happens, okay? First of all, when this epidemic, anytime, a lot of people look and think of doctors as miracle workers, and that every time you have a cough or a sneeze, we know what's happening, and that's not reality. When this epidemic began in 1981, I was working as a second-year medical student with one of the leading researchers around this, and they didn't know what it was. In fact, it had several names before they called it HIV, the virus that caused AIDS. They called it GRID, gay-related immunodeficiency. They called it gay bowel syndrome because it wasn't known. Nobody knew what it was. Now, once people knew, the first thing that was known was a lot of the ways in which it was transmitted. So it was clear that sexual transmission was going on, that drug transmission through dirty needles was going on, and those things became clear, and messages of prevention began to be sent out. But this is the first disease in which social, political, moral, religious, and everything else played into medicine. So in all of that, you have to remember that a lot didn't get known, a lot wasn't known, and conspiracies and things like that, that wasn't really what was happening. What was happening was the lack of knowledge with a large number of people presenting with this illness. Laura.
Over there.
I have a question. If blood is on the surface at any time, how long does it live? And if you come in contact with it, can you catch it by, relating to the other man's question? Can you catch it if you have like just an open store or something, or if you just come in contact with it, and how long does it live?
Theoretically, it is said that it takes 1 minute for the virus to die. Just, once again, a lot of what I do is, also general principle stuff. Try not to mess with blood. You know what I mean? If it's moist, if it's wet, try to avoid it if you can. If there is HIV virus alive in that blood and you have any sort of a cut or open wound and you touch it, yeah, there's a risk. Yeah, there's a risk. It's a risk I wouldn't take.
I heard that if it was on like a bench or something like that, that it could live for a while. But I guess this individual was wrong about that, because I had a fear that if you came in contact with it, no matter where you were, if you just touched it, you would get it. But
no, there has to be a site of entry. Always remember that. Once again, you see, and that's one of the things. It's not as easy to get as you think it is. The virus needs a site of entry. It needs an open wound. It needs a mucous membrane. It needs a site of entry in order for you to become infected.
thank you very much.
Blood on blood. Go ahead, sir.
I have a question. I read an article about Magic Johnson, that he had this disease. He's taking medication, but now they can't detect it. My question is, why don't you two taking that medication?
Never said I was or wasn't taking medication, one.
Same here.
No.
Two, Magic Johnson is taking some wonderful medications that Dr. Williamson is actually going to get into when I finish. And all that did, what they can't detect in Magic Johnson is a viral load. Okay? That's a different test than the HIV antibody test. If Magic Johnson takes an HIV test, he's coming up positive. The viral load, which is the amount of virus that's like loose in your bloodstream, that test is undetectable, which doesn't mean there's no viral load. It means it is too low for them to put a number on in the test. That's the piece. He is not cured. He did not buy something that none of us can get. He's taking some really good medications.
Thank you.
You're welcome. Go ahead, and then we're going to move on.
Yes, the doctor stated that the first case of AIDS virus was in 1954. What I'm trying to understand is this. We were using needles in 1954. We were having unprotected sex in 1954. How come the epidemic didn't burst out in thousands, people didn't start dying until the 80s?
In the 80s is when it became of epidemic proportions. Now the piece is this, a lot of people have died from pneumonia since 1954. A lot of people have died due to cancers, due to diseases that people with AIDS get now that probably weren't diagnosed correctly. We need to take that into consideration when we think about why didn't it come up before this. They just didn't know. They just didn't know that people that had PCP pneumonia and were dying from it had a compromised immune system, which caused them to get PCP pneumonia. Do you understand what I'm saying? They just didn't know what to call it. They thought people were dying from pneumonia. They thought people were dying from certain types of cancers that were, in fact, probably AIDS-related. I'm sure a lot of cases went undiagnosed within that time span. Body fluids, high-risk body fluids, blood, semen, vaginal fluids, breast milk. These are the body fluids, guys. These are the things you want to be aware of when you're interacting with another human being. These are the body fluids you are going to try not to mess with. Low-risk body fluids, saliva, snot, mucus, sweat, urine, feces. These are body fluids that do not contain a high enough concentration of HIV to transmit the virus. A lot of people have a problem with saliva. Saliva does not transmit the virus. What they will say is that if you drink like a bathtub full of saliva, there's a minimal possibility of a risk of transmission. Now the piece is this. Once you have that information, if you're still concerned about saliva, seek help. You got no business drinking a bathtub full of another human being's saliva. This isn't even for you. Seek professional help, get an evaluation. You should not be drinking that much saliva.
They say when you got cuts in your mouth, you kiss, you can't transmit it like that.
All right, now this is what needs to happen. Can I use your hand again? This gentleman has a cut right here on his hand. This way, right here. Hold your hand up. I have a cut right here. In order for transmission to occur, they need to connect like that. Thank you again. Now, in order for that to happen within the mouth while two people are kissing, that's a very complex thing we're trying to get to happen during kissing. It hasn't happened. My personal point of view, I mean, think about it. We don't know who's positive and who's not in this world. If kissing transmitted the virus, a lot more of us would have it. And that's a fact.
Say you have a couple. Let's say you have a couple people that are married and they're planning to have children. They're HIV positive. They're on medication and the viral load is undetected. Would they be able to have a child without the fear of the child being HIV positive?
So you're talking about two people.
With the HIV.
I know. Two people that are HIV positive, they're married, they want to have children, they're both on medication, the viral load is undetectable. Can they have a child without worrying about HIV? 100% no. First of all, there's a couple of things you're trying to take into consideration here. You've asked a really complex question, believe it or not. Because one, you have two people that are positive, they should not be practicing unsafe sex. They both have the virus. They shouldn't be exchanging those body fluids. It's not healthy. It could advance the virus they are carrying. It could increase the viral load. It could change the strain of the virus in their body. Now, if an HIV positive woman is pregnant and she is receiving medical care, and this is really important for mothers, and this is really important for those of you that have loved ones that might be in this situation, the news that's coming at us about women that are pregnant that are HIV positive, I mean, it's like hot off the presses. I mean, they just keep coming up with all these new things that are really working great. It was just yesterday, I believe, Diana? Yesterday, they came out and said, if you're following your doctor's recommendations and you're taking certain medications, you can reduce the risk to less than 4%. There are hereditary birth defects that the risk factor is higher than transmitting HIV to your infant. Does that answer your question? Okay. Mucous membrane transmission. Much of transmission happens through our mucous membranes. We're talking about the canal of your penis. For those of you that don't know, it's the hole at the tip of your penis, the canal of your penis. The anal canal, the vagina, the nose, the mouth, and the eyes. Does everybody understand that? These are sites of entry for the virus. Everybody understands?
Right. Well, that's just like I was reading a pamphlet on this congregating where it said that I guess you contact HIV virus from a person giving another person oral sex. That was what the pamphlet said.
About, I'm sorry, could you repeat that?
The pamphlet said that a person could catch HIV through oral sex.
That they can catch HIV through oral sex? Absolutely. Yes. Did everybody hear that? Oral sex can transmit the virus. The reason why I'm repeating that is because that's the one piece that people seem to get stuck on. People like process all this information and they've got it and they have a healthy fear and they're trying to do this, that, and the third to protect themselves, and they act like nobody ever told them that oral sex can transmit the virus. I understand the want to believe that something is safe, Believe me, I understand that. I live with this. I want there to be something safe. The reality is that there's not. You take a chance. Go ahead.
I'd like to throw a couple questions at the doctor, please. If a person got HIV and they're positive HIV, and it's known that they got HIV, and then there is a female, either male or female, and they study having these babies. They study having these babies. Now, on the political standpoint, half of these people is not even trying to get fixed for them not to have children, even though some of these people is not educated to the point to know what they're doing is wrong. But we got these big politicians and all this trying to say that they want welfare reform in, but then again, they're spending more money on fighting this AIDS thing, but they're not doing too much on prevention of it. Because if a female got the HIV virus, to keep from spreading it are either costing more money, which they call themselves saying it's a problem for the research, because it's always a dollar figure. She shouldn't be allowed to have another kid knowing that you're going to put this human, that's unborn baby, respect the rights. But they are still having these kids are being born HIV positive.
Okay, that's a very long question, but remember, it takes two to make a baby, okay? And a lot of times, people do know the information. They know that if they take medications, in particular, to have AZT a part of their regimen, that they have a very low chance of transmitting. I don't think we have any type of right to tell anyone completely that they cannot do something. We have to give people the information and allow them to make their own decisions. And part of that decision, in terms of a woman deciding that she wants to have a baby, is knowing that if her baby's positive, what's going to happen, and if the baby's negative, what's going to happen if the baby outlives her. Okay? Let's go.
Okay. And just on that same note, having a baby is a personal decision, whether you're HIV positive or not. I hear your point, but everybody has a right to make their own decisions in this life. I hear what you're saying. I'm just saying that it truly is a personal thing. Okay, let's move to this, because this is the piece. Gentlemen, this is the piece that you need to take with you. Whatever else you hear, you want to do whatever you want to do with it, this is the piece that you need to know, because it's the behaviors that dictate whether or not you get this and whether or not you spread this. Sex, vaginal, anal, and oral. We're going to keep this real simple so as not to complicate it. However you want to freak that off with two human beings or more is a high-risk behavior. Does everybody understand that? There is nobody that is so slick, that is so smooth, that you have figured out the way to do this without getting the virus. You can't guide your ship through the water in any different way than any other man and think you're not going to get this. You don't stand on your head, you don't say a prayer, you don't do any of that, because it doesn't prevent this from happening. Drug use, injection drug use. Anybody in here an ex-IV drug user? I hear you. Everything involved in the process of shooting drugs can transmit the virus. Everything. It's the needle, the cooker, the water, the cotton, whatever the water is in. They say do not even share the same tie-off or tourniquet, being that if I tie off over open tracks and I hand the next man that tie-off, he's immediately tying off, and if he ties off over open tracks, you have a risk of transmission from occurring. So, in a perfect world, we try to say don't share needles, because everything involved in this process can mess you up, can transmit the virus. Is it about this? Is it about what I'm talking about? What?
I have a question.
How many times can a person be tested for the HIV virus and actually have the virus and it not be detected?
There's a window period. It's not a number of times, you know, per se that would matter, but there is a window period, which we're going to get into, but I'll just tell you briefly that it's from the point of infection, when you participate in the high-risk behavior and get infected, from 3 to 6 months from that point, you can test negative and actually be positive. The hit is this: from the time you're infected, you can transmit the virus. So if you're in the window period and you're testing negative, but you are positive, you can transmit the virus. I need to get done with this one part, and then we'll address other questions, okay? Other drug use, other than IV drug use. High-risk behavior, yes or no? Yes. Why? Other than sharing needles. Let's forget about sharing needles. We've addressed sharing needles. We understand that that's a high-risk behavior, everything involved.
You know, like a lot of people smoke crack cocaine, and this make you more into, sexual.
Okay. How many people have smoked crack? Okay, if you say so. The reality is that you're absolutely right. People can engage in higher risk sexual behavior. They'll take more of a risk when they're under the influence. That also goes, you see, because some people are really sitting here and they're thinking to themselves, I can't get this. I don't smoke crack. I don't shoot dope. I just have a few drinks. I just smoke some weed. I'm not like those addicts. Well, I have news for you. Any drug, including all alcohol, that you put into your body is considered a mood and mind-altering substance. Get it? Mood and mind-altering substance. Meaning it alters your mood and your mind. A lot of people don't make the best decisions of their life when they're under the influence of alcohol and drugs. Point in case, I don't know about anybody in here, but you can walk into any bar, any town, USA, and let's say it's dead, and you walk in and there's somebody sitting there, and you look, it's nobody you want to talk to, nobody you want to mess with. You keep walking, you go to the end of the bar. You pound down a couple of 4 to 10 drinks, ain't nothing going on in the bar, you're going to find yourself creeping back up the bar, and all of a sudden you want to talk to somebody. You didn't want to talk to them when you were sober, man. The reality is you can wake up in the morning, you can look next to you and be like, oh, damn, what I do now? What's done is done. You can kick somebody out your bed, you can kick them out your house, you can act like you don't know them when they try to talk to you on the street. You can do all that if you feel you need to. The reality is what's done is done. And you could pay the ultimate price for those actions. Does everybody understand? Risk reduction. Sexually, when we're talking about sex, how do you want to protect yourselves? Latex condoms. That's the piece. You want, what kind don't you want to use? Lambskin. Animal skin condoms will not protect you against the virus. They are porous. The virus can pass through the pores. You want to use a latex condom with non-oxidol 9. Excuse me. What about when you're performing oral sex on a woman? Saran wrap. Homeboy had a plan at least. He's working with something. Now we're laughing, but at least he had a plan. He was the only voice I heard. He was the only voice I heard. The reality is they actually have dental dams, gentlemen. Square pieces of latex. You can cover the woman's vagina, or you can cover your nose and mouth and do what you need to do. Saran wrap, if it's microwavable, is porous. That's reality, though. You need to have that information. Saran wrap is porous if it's microwavable. So it beats a blank, but go for the latex. Cut a condom up the middle. Cut a latex glove. However you need to do what you need to do in order to protect yourself. I know how it sounds. I mean, I hear the laughter and I hear you. Once again, I'm going to remind you that I'm positive. I know what I'm talking about. I hear you. But the reality is, it'll protect your ass. There's no piece of ass out there that's worth your life. Doesn't exist. We can talk, but I'm still going to say it doesn't exist. It's just not worth your life. Mother-to-child transmission can happen in the womb, during the birthing process, or during breastfeeding. We already told you that just recently, due to a new study they were doing, they found out that when you take certain medication, it reduces the risk factor to less than 4%. That ain't bad. Medical overview. This is called an iceberg model. Does anybody know why it's called an iceberg model? I'll tell you why then. Generally in an iceberg, all you see is the tip, what's above my arm, and you can't see all this stuff that's going on down here. And this all needs to be in place in order for this to be where it is, in order for the tip of the iceberg to even exist. So right down here, before you enter the iceberg, know this. This is before you enter the iceberg. You don't need to be a part of this. But if you are a person engaging in behaviors and activities that can result in HIV infection, you see the arrow? That's where you're going. That's where you're heading. So boom, infection occurs. Now you're positive. There's initial symptoms after infection. It's an acute response to HIV infection. It's like having a severe cold. Does anybody know what mono is, mononucleosis? It's very similar to that. Your body responds to this foreign virus invading it. Now, what happens is within 2 to 14 days, it begins, and within about a week, it goes away. So most people don't say, oh shit, I have the virus. Most people say, man, I had the flu. Thank God I got rid of it. It was killing me. Even if you take this information and you decide to engage in risky behavior and initial symptoms occur and you say to yourself, wow, this woman came and she told us that this could happen. I know what I did last week. This could be HIV. And you run and you get tested. What's going to happen? Nothing. Nothing. You're going to come up negative because you will be in the window period, which once again is 3 to 6 months after the high-risk behavior. And what you're taking into consideration is that you haven't been engaging in high-risk behavior during that time. Once the window period is over, seroconversion occurs, which means that you will begin to test HIV positive on an HIV test. The first stage of infection is asymptomatic HIV infection. Somebody tell me what that means. Absolutely. So you show no signs or symptoms. That's an important piece because some people, once again, think that they're so good at assessing other people that they can just look at somebody and call it. They got AIDS, they don't. And a lot of times people aren't even thinking with their head when they're saying these things. They're thinking that they're trying to go to bed with somebody. Honey looks good, she can't have this. She talks good, she's got an education. She can't have this. She's clean, she can't have this. The reality is there's not a doctor in the world that can look at somebody and know if they're HIV positive. What makes you think you could? Can't be done. How long can this last? How long can somebody stay asymptomatic, guys?
6 months.
6 months, wow. Anybody else? 5 to 10 years, 12 years, 17 years. Go ahead, Joel. You're making me live longer as you speak. The reality is it's human being specific. There are people that have had this virus for many, many, many years, and they remain healthy. There are people that take certain combinations of medicine, and they remain very healthy. Which brings me to my message. We live. You can't dictate, no doctor can dictate, nobody can dictate how long I will be asymptomatic for. Nobody knows. Nobody can tell you if you become positive or if you are positive when you're going to get sick. Don't buy into any bullshit lifeline somebody tries to sell you. It's theirs, man. We can live. If, in fact, the disease progresses, you can go into HIV disease, which is symptomatic HIV infection. Your immune system is weakened. Oral thrush can happen at this point. Does anybody know what that is? Yes. Tell them what it is then. Oh, I'm sorry. Go ahead. Right, it's like a white coating on the tongue inside the mouth. There are other things that are indicative of HIV infection that aren't indicative of AIDS. In women, vaginal yeast infections, which doesn't mean that every woman that has a yeast infection has HIV. In women with HIV, they become harder to treat, and they become recurrent, meaning once you do finally treat it, it can come back. Are there any symptoms you want to add to that, Diana, for symptomatic HIV?
No.
Okay. If, in fact, the disease progresses, you will be diagnosed with AIDS. In order for them to diagnose you with AIDS, you need to have a CD4 T cell count of 200 or less, or you need to have AIDS indicator conditions. This is a really serious part of this. I'm just going to go over a couple of the diseases that people with AIDS die from. And I just want you to be aware that I've been doing this for years. I mean, I can't even count the times I've done this presentation. And this is still the hardest part for me. You see, because I can remember being in the mix. And you know how sometimes you think that, you know, you're going to die because you're just doing too much shit not to die? And you try to say, well, I hope they shoot me in the head. I hope they don't beat me to death. I hope they don't stab me and I bleed to death. And I hope they don't burn my shit down while I'm asleep. So I would always hope that I would get shot in the head. That was just my general thing. I can't pick a disease. Out of all the diseases people with AIDS get, if this is the horse I'm going to ride out on, I can't pick one. They're all painful. They all suck. And I'm just going to say that because there's no nice way to put the diseases that come with AIDS. There's AIDS-related dementia, which is when the virus attacks the brain, memory loss, general loss of your mobility, your functioning. There's wasting syndrome, which is basically what it sounds like. You waste away. You lose generally more than 10% of your baseline body weight in a short amount of time. Persistent unexplained diarrhea will occur and constant chronic fatigue. There's Kaposi's sarcoma, which is skin lesions. It's a form of skin cancer. It's going to be lesions on your skin anywhere on your body. Lymphomas, which is cancer of the lymph nodes. And there are more diseases. We could go on. Does anybody have any questions about any of that?
You forgot the pneumocystis pneumonia.
PCP pneumonia, leading cause of death amongst people with AIDS. Thank you. Absolutely. Swollen lymph nodes can happen. The reason they're not considered symptomatic, and they do happen to people with HIV, because what they are is a reaction to HIV. But also, if you get a cold, your lymph nodes are going to swell. That would be behind your ears, down your neck, under your arms, and in your groin. Is everybody clear? All right, guys, thank you.
Now that we've gone over a lot of the basic information, what I'd like to do is take us to the point of treatment and put it in the context of how the virus works so that we understand where the medications work and how and why they work. Now realize that the medications and everything need to be taken in the context of knowing that you're positive, but becoming well aware of how you want to, that you need to change your lifestyles, that you need to exercise, you need to rest, you need to eat properly, so that these medications can work the most effectively. And also that you understand that there are side effects. You know, there are toxicities to any medication that you take, including Tylenol or aspirin. But one thing that I like to think and remember is that there's no worse side effect than HIV that's allowed to continue to grow without any stop points in it. So when we look at the HIV virus comes, and in order to, it has to get into your body, and it has to attach to the cell that Laura mentioned, the CD4 cell. And that's an important cell in the immune system. And for that virus, it comes in, it attaches to that cell. How does it get in so easily? It just happens that it happens to fit like a key in a lock. And so it gets right in. And once it gets in, it uses things that we call enzymes. And I like to think of it as the engine of a car. And I like to think about the person who's become infected as either the passenger or the driver, okay? Now, if you're the passenger, then what happens is the virus comes in, it uses all of these enzymes, and it comes and makes more of itself, and it makes a whole lot more of itself. So for every T cell or CD4 cell that gets infected, you can make a lot of virus particles, not just one, and more than one can attach to a T cell. And they come out mature, they come out with a lot of energy, and they can just keep attacking more T cells, more CD4 cells. Now, there's a test that's been available for at least now 2 years called the viral load, and we've mentioned it a little earlier. And what the viral load does is it tells us how many particles of virus are in the bloodstream, okay? And only there. We're not talking about the lymph nodes, we're not talking about semen or vagina. We're talking about in the bloodstream. We're not talking about around the brain or any place else. But by knowing that, we know that if we can stop this virus from growing, if we can stop it and keep it so low that you can't detect it, then we can halt HIV for a period of time and prevent the progression to AIDS. And that's where the strategy, and that's where the keys are. So think of yourself that you don't know this information, and you're in the passenger seat. This virus is going and it's growing. And sometimes it's coming out looking exactly like it went in, but sometimes it comes out and looks a little bit different, okay? And as it looks a little different, what happens is that it can make such different types of it that the medicines may not work effectively on every piece of particle coming out. So what we want to do is hit hard and hit early with medications. And the medications are in 3 categories. The first category is the nucleoside analogs, okay? And in that category, they're called the reverse transcriptase inhibitors, and you have the drugs like AZT, 3TC, DDI, D4T, and DDC. Those are the 5 drugs, okay? And you think about it in a certain sense that it's almost like an alphabet soup, you know, that you have to remember a lot of names. But if you remember the general category, they all work the same. In fact, they work so much the same that 2 of them have been put together into one pill called Combivir. And that makes it easier to take, so that we're trying now to reduce the number of pills you need to take. But we need to hit more than one target. And that's the key, that in 1997, no one should be on a single drug. Drugs are now in combination. And we talk about them as cocktails, you know, and I always say, you know, now the concept of cocktails, you're not going to always think of an alcoholic beverage, because a lot of times when someone says, I'm on a cocktail, they're referring to HIV medications, okay? So on this enzyme, we have 2 targets in the same spot of this engine. And let's say that now, because you know this information, and you're knowing about and learning about the medicines, you're now in the driver's seat. And whether you're using a key or you're hot wiring the car to get it started, you're still in control, okay? And you're getting this car started. So you're taking the medications in combination. And usually it's 2 in this combination, in this category, the nucleosides, and that's why they combine the 2 pills in one. Or it's 1 in this category or 1 in this category. Now, in this category, the non-reverse nucleoside analogs, there's 2 available drugs right now, with more coming out, dolaverdine and nevenapine. And one is called also, the names are Rescriptor and Viramune. The most important thing to know is that the information about these medications is available to you. If you yourself can't read the information that are in your packages or that you get from your support groups, then you need to go down to medical and ask more about these medications, okay? Because right now I'm going to be giving you general concepts. The third group are the protease inhibitors. And this is what everybody hears a lot about in the news and in the newspaper. But I want to tell you one thing up front, that no protease inhibitor can be taken alone, and that every single study that has included a protease inhibitor has included drugs from this category. So that's how we figured out that combination therapy was the way to go. because people on combination therapy did so much better than anyone on a single medication. So in this category, we have several drugs. We have Crixivan, we have Sequinavir, we have Norvir, and we have Viracep. And those are the approved ones now, with more coming out again. And what happens is that, you know, the drugs do have side effects. They do things to your body that you need to understand. But the most important thing is that these drugs in combination can effectively drop the amount of virus in your bloodstream so low that you can, that asymptomatic phase that we were talking about, that was more individual controlled, that Laura was mentioning, we can prolong that. And that's the goal of taking HIV from a chronic, acute disease and making it a chronic disease. We want patients to avoid going into the top of that iceberg where they begin to have AIDS indicator conditions. And what's interesting is that that a lot of these studies were done in people who had advanced disease. So they had low T cell counts, they had high viral particles in their blood, they had a lot of virus. And what was found was that even those who already developed an AIDS-related condition, there was less and less of a chance that they would get a second infection. And that was what was the interesting thing, that even in AIDS, we could still prolong life and see a difference and help increase quality of life. And so really the message is that not only are there new treatments so that you need to be aware of them, not only is it important to know your status, but it's important to learn about these medications, because when it's time, if you are positive, and it's time for you to make decisions about these medications, you need to know so that as a partnership with your healthcare provider, you can make the decision of which ones are best suited for you. For example, if, for instance, you told me that you had a history of hepatitis or chronic diarrhea, then I would tell you, well, gee, if you have chronic diarrhea, Viracep might not be the best protease for you because that causes diarrhea. So knowing your body helps me point out which medicines might be more suitable. If you tell me that in your family you have a history of kidney stones, or that you yourself had a kidney stone, then I might turn around and say, well, you know what? Let's be real careful because Crixivan causes kidney stones, okay? And if you said to me that you're on methadone, okay, and that you really, you know, need your methadone, then I might not want to give you Norvir, because if you throw up, that's one of the most common side effects. You lose your methadone, who's going to get back online and get it again? Okay, so you're not going to be able to get it again. So these are the things that and it's why you need to know your body and you need to know these medicines so that you can help. Now, I have to also tell you that a lot of the side effects, and particularly in this first two categories, go away. So it means that you have to tolerate things for a little while. For instance, with AZT, it can cause headache and nausea. So can Crixivan. And so you have to be able to tolerate the side effects because they go away in a period of about a month. But what happens a lot of times is that people start taking the medicines, they start feeling sick, and before talking to anyone, they stop it. And if you stop it, then you're allowing the virus to grow again. You can develop resistance to the medication. And in addition to developing resistance to the medication, let's say you didn't develop resistance, when you go to start the medicines again, you start at the beginning. And so you start with the same side effects all over again. So that's why it's important to know what is expected. You're going to expect side effects. And if you know what they are, and you know that they're supposed to last 2 to 3 weeks, then if they continue past that, you need to get in contact with your doctors or your healthcare providers. In this middle category of drugs, these are pretty much the newest ones that have been coming out this past year. And there's 2 right now in that category. And again, those drugs were also studied in combination with the first class, because the first class were the ones that were developed the earliest. AZT was the first drug developed for HIV and AIDS, and all the others in that category came along after. So these drugs also can be used in combinations. And that's why it gets tricky, because you can use 2 from here, 1 from here, 1 from here, and in certain cases you can use 4 drug combinations depending on how high the viral load is, how high those numbers are. And high numbers, we're talking that you get that viral load test and it's 100,000 copies, or 1 million copies. Those are high numbers. Low numbers, we're talking 10,000 or below. And anything in between that is sort of the gray area. but we're really talking that we can actually measure how much virus is in your blood, and based on that, decide how hard and how much medication you need to take. Now, pretty much every drug has their own dose, so there's standard doses for everyone, but there are things that you need to take into consideration. And so if you had, for instance, told me that you have numbness and tingling, or that you are a diabetic, then that's important information to be able to pass on to your clinicians. Okay? So that you need to be able to pass that information on. If you pass that information on, then we would be able to test and check you and make sure that you don't develop severe side effects to these medicines. One thing that I always like to address, because even if it's not asked, it's something that's always brought up. AZT, it was the first drug out there. And as being the first drug out there, it's a lot of times considered poison. A lot of people will tell stories that, you know, I knew someone, he was doing fine, but as soon as they gave him AZT, he died. Well, there's two sides to that story. And the first side to it, I'm going to talk about the healthcare system. When AZT came out for use for HIV and AIDS, we didn't know exactly what the right dose was. We didn't have the full understanding of how this virus replicated. And we didn't know that one drug alone wasn't the right thing. On the other side of that street, there was a push and a pressure to get any treatment out there, to get something available, push it out. And so the FDA changed, and that's the group that makes and approves medications. They changed the way that they approved it, and they accelerated the approval of medications. So you had a few things going on. But also, has anybody here ever shared their medicines with someone else? Okay? Well, that was happening too. You know, you'd hear that Johnny was on the corner. Johnny didn't like to go into healthcare, so his friend went in, and they gave him this bottle of pills. And so one person was being monitored, and maybe 2 or 3 other people were taking the same medication. And maybe they didn't even know their status. And so they would come into the healthcare system much more advanced. They were sicker. They were coming in with AIDS already, with PCP, and such advanced disease that it didn't matter that we were given AZT. You may as well not have given it. They would have died anyway. And so the picture of AZT as poison is really on both sides, a lack of education on the part of the healthcare system that we didn't know, and a lack of knowledge in the streets. And so there is no medication that doesn't have a side effect, but there is no medication that is purposely put out in order to kill or poison people. And AZT is one of them. AZT, remember, with every category of drug, every study has included AZT in order to get their approval, because it's one of the most powerful drugs that's been there. So those are things that we have to keep in mind. And I know I may have opened a Pandora's box for where a lot of questions want to come up, but I actually took time out and went back to school and back to training to look at the history and how did this myth get mixed up, because so many people were refusing the medications. And that I had a difficult time seeing young people willing to die rather than take medication that could be life-saving. And yeah, the reality is that medicine is not it in of itself. If you continue risky behaviors, then you can take all the AZT and 3-TC and DDI and protease inhibitors. You can take all of them in the world, but it's not going to do anything if you're still shooting up, if you're still having unsafe sex, if you're still not eating properly, if you're not exercising or resting. So if you don't take care of your body, then there isn't anything that you can put into it that's going to do it. There's no substitute for what you yourself start doing for your bodies if you are indeed infected. So that needs to be kept in balance, because since the medicines all have side effects, you need to know your body. You need to be able to come and say what you're feeling. And if you have no concept because you're not paying attention and you're, messing up and you don't know whether your headache is due to the hangover because you had a lot of alcohol the night before, or it's due to your AZT, then how can anyone help you with those decisions? So it really takes a holistic approach, meaning look at your life, look at how you're living, look at how you're eating, look at what you're doing, and trying to put that into order. And then you add the medications to help fight the virus and knock that virus down. And then also, if you develop, for instance, PCP, we talked about it being the most common okay? There's medicines to prevent it. And so you need to be able to know and follow those T cells, follow that CD4 count, so that if it becomes and hits into the 200 range, then even if you don't have PCP, you want to start the prophylaxis. You want to take the medications to make sure you don't get it. Remember, we're talking about prevention, and there's prevention of HIV, but there's also prevention of HIV progressing to AIDS. So there's two types of preventions going on. It's primary prevention and then prevention within the fact that you may be positive. So getting back to the medications, they're in combination. That's message number one. Don't take any medication by itself. Message number two is that you need to be ready. Right now in 1997, all we can tell you is that you need to start the medications, but we cannot tell you if you can stop or when you can stop. Okay, so that means that you're committing yourself to a regimen of medications that you need to take for the rest of your life at this period in time. More information may come out later, but at this point in time, we're committing you to a lifelong commitment. And, you know, in a certain sense, you guys are used to that. You know, you have sentences, and some of them are short-term, some are long-term. Whatever your bid is, that's your sentence. You have nothing, no control over that. It's the same concept when you're talking about the medicines. Once you start, you can't stop, okay? Okay, and that's critical. You cannot stop. And so what's important is to adhere, is to be compliant, it's to know your body, and to know what you're doing on an 8-hour schedule if your medicines are every 8 hours. Or if your medicines are twice a day, what are you doing during the time that you need to take your medicine? And what means do you need to get help? Do you need a reminder? Do you need a buddy who's on the same regimen who's going to call you and that you make a commitment to each other? Okay, so you need to think of all these type of things when you're thinking about medications. Most importantly, you need to know that if you're in the driver's seat of the car, you are in control because you have the information and you are getting smart. But if you let yourself shift to that passenger seat, then, you know, what if the driver decides to just say, hey, I'm going 90 miles an hour and I'm not stopping, and they just put their foot on the gas and say, go. You know, you're headed for a crash. So you need to always be in control. Be in the situation where you know the latest information. Know the science that the scientists know. And I challenge everybody to that because it's not so complicated. Fear makes things seem more complicated and makes it more difficult. And so we need to bring that back home and realize that that's not the case. And with that, I'd like to just open it up for a few minutes that we have left for questions. I'm going to ask for the mic to be passed around so that we can hear all the questions. Okay. Question, right? Can you wait for the mic? Just 1 second. Okay.
When you were talking about the medication and everything, like I take medicine myself, and the only way that I can, when I go to my doctor and everything, I tell my doctor, they say, how you feeling? I just can't really tell them how I'm feeling because the way I monitor myself, I write down abnormal things that happen to me, like headaches and stuff like this right here every day of my life. And then when I go to the doctor, I say, well, this is what happened to me such a day. This is how I can monitor my medicine, get on the right type of medicine that I'm on. But that's how I monitor.
That sounds right. You're writing down what normally occurs, and you compare that with something that happens that you don't expect, and so that you can tell your doctor. And then again, they monitor your blood. And by your blood, they can also tell how good the medicines are working on you.
This way they can find out exactly what type of medicine I need to be on.
That's right.
If I got on the medicine
That's
now,
exactly right.
I will have a lot of side effects that I thought were just...
That's right. That's what I mean, is to know your body. That's
Okay.
what I mean, to know your body. Okay, and please use the microphone.
Yes, ma'am. I have a question. I was on AZT from 91 to 97. I got off and I got put on Eric Epivir and with Vericep, I guess. Okay. Is it possible that they're going to ever find a cure?
A cure to?
For the virus. That's what I want to know. I'm saying, is it possible? I take about 500 pills a month.
Okay.
I count them up. It's 71 a week.
Okay.
So then it's 4 weeks in a month. So sometimes 5. That's a lot of medication.
Is it possible that there will be a cure to HIV? I hope so. I challenge everyone every day to put me out of business. The most probable way that there'll be cures to HIV is like with any other virus with a vaccine. And there's a vaccine that's being studied right now that's a therapeutic vaccine, so it's being used in patients who have HIV to help prevent and decrease the amount of virus in the blood. So yes, I mean, you got to keep that hope that there will be a cure. This is not one of the longest epidemics. You know, there's still no cure to hepatitis, which has been around for a long, long time. So this is not yet one of the longest epidemics in history. It's just one of the most complicated.
Yes, Doctor, I have a couple questions. The first one being a two-part question. Does the use of drugs, for say marijuana, speed up the virus of HIV in the system? And if so, what do people that have cancer that use marijuana for whatever reason to reduce their cancer or whatever that is, what do they do for?
Okay. Are you talking about the use of illicit drugs, like drugs that are not legal? And
yes,
what that
marijuana.
does?
If they were to use that and have the HIV virus and also have cancer, they're using that for a treatment for their cancer.
Actually, marijuana has been formulated into pill form because its usefulness in cancer for nausea is very important, but also in HIV, in particular when people begin to lose their appetite. It's an appetite stimulant, so it helps. So marijuana is sort of moving a little bit out of that category of being looked at as an illicit drug, although Florida is not one of the states that has done that. So far, it's only California that lets people actually smoke marijuana. The other states, you still have to use the pill. And the pill seems to work very well in people who've never smoked marijuana, but in people who've smoked it, they prefer the smoking it, so that sometimes becomes a problem, that you may end up, even cancer patients, taking the risk of going out and buying an illegal drug and getting arrested behind it. Yes, the role of it has been shown so importantly that they have made it into a pill form that's available. It's called Marinol.
Marinol.
Okay.
The second last question being was, is there any bearing that a person that has HIV virus, do they run it, when they want to have types of insurance for, say, health insurance, is there boundaries or limitations that they run into, being that they might have that disease?
Yes, there are. However, since the protease inhibitors came out and the understanding that combination therapy, I have to say this with caution, in New York State, insurance is available, but the insurance makes an exclusion to anyone with a history of substance abuse. So anyone without a history of substance abuse and HIV can now buy some type of insurance. Okay. And I don't know how that pertains here in Florida, that law. Microphone? Right there. And then we'll continue.
All that sounds good, that what y'all said, that we should get tested and to know about AIDS. But I think if I get tested, just knowing that I have that disease will kill me.
Okay, you know, I think maybe Cully or Laura might have something to address that, but, you know, I think that fear, I like to think of fear, and if you could think of the E in fear for a moment as an I, fear is false information appearing real. And what happens is that when you get so scared about something, you feel that you're going to die, but that's not the reality.
I want to ask.
I used to think like that too, you know, that finding out I would kill myself. But then I reflect back on something that hit home for me. I stood in front of a judge and it took 10 years. I told myself I couldn't do it. I did every day of it. Every single day. The mind is a terrible thing to waste. The mind can adapt. It can do things that we don't give it credit for being able to do. You're doing every day of whatever it is that you're doing now. What's the difference between being HIV positive and being locked up for the rest of your life? There ain't no difference, man.
My other question was, what made y'all go out and get tested? And you too.
I was in the penitentiary doing the things that I like to do. I made a bad judgment call. I took something from somebody I had no business taking it from, and there's certain repercussions that come with it. I got hurt up in the penitentiary, and I got taken to the hospital. Before they did anything for me, they tested me. They told me I was positive. They saved my life. Then they told me I needed to do my own job to keep it.
I just knew I was at risk. You know, my lifestyle dictated that I would have this, and my whole piece was I needed to know. You never know what you'll do. Don't ever project to what you'll do, because believe me, I made all sorts of deals with God, the devil, and everybody in between about what I would do if I came up positive, and I decided I wanted to live. So I was wrong about what I thought would happen.
And I got tested because I got stuck by a needle at work, and I went through the anxiety as well because it was a deep needle stick, but I went ahead and got tested as well. So I noticed that you asked just them. Don't think that doctors or anyone else are not at risk. Not even just because I got stuck, but my behaviors may also be behaviors that would put me at risk.
Doctor, I wanted to ask about something following up about medication that you were talking about, hospitalization. I thought there might be a fear, I know there is for myself, getting out soon and being tested. I think it's hard enough for an ex-con. I've done the better part of my adult life, getting out and getting a job and getting out and getting hospitalization, getting a decent job and things of that nature. I thought this may be another. It's obvious the reasons why you'd want to know, but there's some fears about knowing too, because who else does know? Who has the right to know? Does it leave when I leave here? If I tested positive, I took this test after you all leave and I go out to get a job and I'm positive, does it kill me from my job? Does it shoot me down? Nobody's going to give me health insurance at a position. Who's going to take care of me? I got no family left out there now.
Okay, let me just say this. If any of that happened to you, you'd probably be the richest ex-con in Florida. It's illegal for any of that to occur, and you're protected by New York confidentiality laws. So that's not something that you need to be concerned about. I mean, the reality is the stigma's out there, discrimination is out there, but the law is on your side. Okay? This information cannot...
When you're applying for health insurance, if you're applying for a job, would you have to let people know if you want health insurance when you go for their...
If you're applying for a job under the American with Disability Act, you do not need to reveal any condition unless the condition would influence your job. So no, you don't have to tell.
I got sweet insurance. They don't know a thing. They don't need to.
And I wanted my boss to know I was positive, so if anything happened, man, I would have her support. You know, it's better for them to know than not to know. Because when things start setting in, just for me, you know, I work in the field where I deal with other people, you know. This is my life, so I put myself out there. You know, I wanted my my people to know.
We're done.
Okay, we have maybe the last question.
Doctor, what I would like to know, I've been HIV positive for about 8 years now, and I'm at the point where they say no detection.
Right.
But my major battle have been with the pneumocystis pneumonia. Now, since I'm at the point where they say no detection, will I have to worry about the pneumocystis pneumonia again?
As long as you're taking your prophylaxis, you should have less of a chance, but once you get an infection, like pneumocystis, it sort of stays in the body.
Yeah,
so
right.
you need
I had it 4 different times.
Right, so you need to always take your medicine for prophylaxis. That's your lifeline, not to miss those medications and
All right.
continue to
Thank
take
you.
them. Okay. Okay. We have 2 minutes left. Okay, one last question.
Doctor, if you've taken ACT before, right, and you went off because you had a problem with it, my muscle, so can you start again on ACT with two new drugs, though you've taken it before?
So the question was, if you're on AZT and had taken it before and stopped it because of some side effects, can you take it again? The answer to that is it depends on how long you were on it and what kind of side effects you were having. But in most cases, AZT can be reintroduced in combination with at least 2 other medications that are new.
Thank you, Doctor.
Okay, I'm sorry, but this is about all the time that we have left for today. And I'd like to say that at least we've started to think about things around HIV and AIDS. We've tried to give you information and build on information that you already had. And in this way, you have the knowledge and you have the power to get tested, get treatment, and in doing so, get smart. Thank you for your attention.
The preceding program was made possible through an unrestricted educational grant from Glaxo Wellcome and was produced by World Health Communications of New York in cooperation with the Central Florida Reception Center of the Florida State Department of Corrections. The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views and opinions of Glaxo Wellcome, World Health Communications, or the Florida Department of Corrections. Before using any medication mentioned in this program, please consult your healthcare provider for more information.